Hello everyone, this is Dr. Schroeder with this week's video introduction to week number 7 of our course in nursing theory and theoretical foundations of practice. And this week, primarily just really discussion question this week, and the discussion questions were focused on this question of advanced practice nursing, APRN. What does that mean? And as the discussion pointed out, it means different things depending on to a great deal where you live and what state you practice in. Not every state is equal when it comes to who is considered an advanced practice nurse, and not every state is also equal into what the actual scope of practice and what the actual rights of a advanced practice nurse are. Some states are much more advanced with this than others. Some states identify specifically that an advanced practice nurse can be an independent practitioner, that they can hang a shingle, as they say, and actually practice independently without any other oversight because they are considered an independent practitioner. Other state boards of nursing don't really define at all what it is. New York's a good example of that. New York really hasn't really defined exactly what it is that what it is that an advanced practice nurse is. Some states say that it's just a nerd word. Start over again. Some states identify just as a midwife or a nurse practitioner. Other states will say a CRNA or a certified registered nurse anesthetist. And still others will say that a CNL nurse, a clinical nurse leader, is being looked upon now as an advanced practice nurse. Technically speaking, not every nurse that has a master's degree, not even every nurse that has a doctoral degree, is an advanced practice nurse. I'm an example of that. I'm a nurse. I have my master's degree. I have a master's degree that was focused primarily in education and management. I do not have my nurse practitioner certificate, and I have my doctorate in education. I really do not meet the criteria, technically speaking, of an advanced practice nurse and an APRN. In some states, however, if I were to become certified as a clinical nurse leader, which I could certainly qualify for, then I could consider myself an advanced practice nurse. But not every state recognizes the clinical nurse leader as a advanced practice nurse. So it does seem a little bit maddening. We talked about that in class. That's what a lot of our discussion was this week. But that's kind of the nature of it. Just like speed limit laws and auto laws vary from state to state, so do state nursing practice laws. The same basic rules apply wherever you go. Again, using the analogy of, if you drive, if you're driving in New York or Florida or California, Nevada, or Texas, the basic rules are the same. We all drive on the right side of the road. We all have speed limits that we have to follow. A red light means stop. A yellow line means slow down, etc. However, the way that some of those rules are sometimes implemented and evaluated are different. For example, in Texas, they have 85 mile per hour speed limits, which blew me away the first time I saw that. In other states, the maximum speed limit is 65 miles an hour, like in Oregon. In some states, you can turn right on a red light. In some states, you can't. There's just different rules that are that way, and that's kind of what nursing's like. There's little rules. The basic rules are the same, but you need to know the specific little rules for your state eventually when it comes down to advanced practice nursing. In week number 7, we're going to shift our focus once again we're going to talk about culture this week. And your discussion question specifically talks about culture in minorities. And specifically, how do we address health disparities with minority populations? Your project this week is a cultural project, or a cultural change project. And I want to clarify this a little bit because sometimes students will hear this and they'll kind of immediately think that this is just doing some sort of a cultural sensitivity presentation, like they would give it their job or workplace. And that's not really quite the idea here. The idea here is to identify a cultural group and then a need within that cultural group. Now, the term culture here is rather broad. It doesn't just mean ethnicity. Here we can talk about different patient populations. For example, a teenage population is a cultural group. Older Americans, older students in a school setting would be a cultural group. LGBT is up big right now. That would be considered another cultural group. These are all cultural groups. It just doesn't have to necessarily just be based on ethnicity. But what is a need that you see within a population that you service? And then what can you do, or what would you propose to present to your staff or to your hospital or to your administrators or whoever, someone in an organization that you identify? What would you propose to them to change to address that? What are the changes that you expect to see? That's really what the thrust of this presentation is all about. That will be due by Sunday of this week. I want to clarify that it will be due by Sunday, not early in the week. And then, of course, the discussion question is also going to focus on the discussion on the minorities. And, of course, then you have a week 7 reflection that's going to be due as well. That will be due on Sunday. I'll make sure that the syllabus is updated to reflect that those will all be due Sunday. So that's the task this week. We got one more week after this one. This is really your last big assignment. It is a presentation. Please review the presentation criteria. Remember, presentations should always begin with a conclusion and, begin with an introduction, end with conclusion, and use some of the feedback that I gave you on your group presentations earlier to help guide you with this one. Please use speaker's notes to indicate what it was what you would be talking about, so that you don't have to cram a lot of text onto the slides themselves. So that's about it. I look forward to having a great week with you in class. Let me know if you have any questions, and I'll see you in the discussion forums.